Hello everyone, tooth care. And do you brush your teeth very cleanly? According to the WHO report, oral disease and tooth loss seriously affect the health of the whole body, especially for the elderly. And the prevalence of other disease in patients with periodontal disease are increased, and including dementia, diabetes, and stroke. The report shows that 45% of the population, equal to 3.5 billion people, suffer from oral disease, which caused by improper tooth cleaning. And the prevalence of bad breath is 15 to 30% in the world, and 90% of it is caused by the bacteria. According to the interviews and questionnaires, we found that incomplete oral cleaning, not regularly returning for dental checkup, and most patients with dementia have oral disease. So how can tooth care help? Tooth care is a device to assist in actually monitoring their dental conditions. The step is 1, to touch, stop, and pick up the detection device. And the teeth will be fixed by blue light to help detect whether the cleaning is correct. And the base will show the cleanings of the teeth. The equipment with the camera will take pictures of the teeth condition. The photo they take will send by to the mobile app to record the teeth information. After using, watering and putting to the base for the UV light. And the device also connects to the app. The homepage will display the dental care status and circulate the desired information page. And the tooth caring detect the cleaning status and show the position of the teeth that are not really cleaned. Recording image. The picture will be taken and recording usual dental condition and provide which it needs. And you can see the date and time on the calendar. And historical recording the clean and nursing status of teeth, and confirm the oral cleaning in the morning, noon, and evening. The last one is dentist appointment. Contact the dentist to check the teeth usually and check the contact information of the dental clinic.
So the following is the structure materials. The disinfection area covers 90 degrees plus 0 degrees polarizer to avoid the light going out. And the diffusion film can enhance the power of light. And the left side is LED displaying, detecting, charging, battery, and housing. And the light bar with the optical fiber and with the 90 degrees and 0 polarizer, and the brightening film at the bottom can increase the correction of the light. And this is the circle board and housing in medical standard steel. This one is emitting fluorescent through refraction. The blue light stimulates teeth to emit green light and the red light, and then fill out the unnecessary yellow light, and the teeth will turn out to the green, and the red one is the plaque. This one is the wide angle lens quickly views the wide range to identify the dental plaque. And this is our 3 main targets. The first one is families using this device and can help each other to enhance the dental health and high cleanliness. Second, patients with oral diseases can improve the effectiveness of disease control. And the cooperative medical institutions point out the instant inquiry of patient condition control. This 3 is our service model. The first one, personal monitoring with smart health monitor can record and return information with Bluetooth and remind to clean the teeth with AI. And the second one, periodontal patients with smart carriers device is operate between the patient monitoring system with 5th generation. Third, medical instruction is with smart medical device and with operation intervention information with 5th generation too. And this sheet is medical device classification. And according to Taiwan FDA and US FDA, Care 2 belongs to class 2nd. And we compare with the product nowadays in the market. Care is a priority to have AI intelligent learning and operation more convenience and non-human resources and environmental protection. And this is market size. In the world, 20 to 50% of the population has periodontal disease. Half of Americans over 30 years old have periodontal disease, and about 1.8 million Taiwanese have oral disease problem. And bed fray has become the most troubling oral problem, and is expected to grow 11 billion by 2024. And the global oral care market was valued at $49 billion in 2021, and it is expected to reach over almost 100 billion by 2030. And periodontal disease has caused a global annual loss of 54 billion loss, and the global total economy has decreased by 442 billion US dollars. And the International Journal of Health Sciences say that periodontal disease increase the risk of surgery-resistant disease. According to research, the tooth decay rate of adults is as high as 87%, and nearby 75% of 60 years old have tooth problems. So our toolkit is in line with SDGs 3.4, and it features clean teeth indeed, oral health care, and prevention of oral disease. So TooCare brings the best oral condition. Thank you.
Dental issues as we age are huge. Unfortunately, if one is already suffering from cognitive decline, this might be a little bit too complex. And also just to get, I guess what it's doing is it's detecting where you're missing, right? And so it's instructing the individual where they're missed so that they can address it with better flossing or brushing. Is that correct?
Yes, not only to monitoring the cleanliness correct, but also take the photo. It's not about the plaque in the mouth, but also the original photos. That makes, if you want to go to dentist, the dentist will see the by day the image you release record. Yeah.
So who are you estimating this would target in terms of the market? Like who would use this product? It could be at any age groups, suggest, right? It doesn't need to be, say, middle-aged adults. Or I was just curious what your vision was in terms of who would say, this is something that I would like to get.
Maybe someone who already have oral disease, or some elderly because they easily to suffer from the oral disease. And if they got this kind of disease will be more serious than other people. But also like families, children's, they don't really check carefully when they brush teeth, and maybe parents can really check for them. So this kind of device can be more help. Yeah.
Thank you.
Thank you.
How sensitive does the device need to be in order to be kind of effective medically? Like how low levels of bacteria does the device need to detect?
because it's using light, it reflects the material that's in the teeth or the plaque that's building up. And so it is quite sensitive, and it can reflect the degree to which there are buildups.
In the US, at least, there's a big joke. Every time you go to the dentist, they ask you if you've been flossing, and you always lie that you have. So I'm just wondering, what is your idea of motivating people to use this device? Because we don't even want to floss. At least I don't.
I answer first. Okay. This because of my father and my grandfather, grandmother, because they have this kind of disease, oral disease. So I want to let them know, just at home you can check yourself. Don't go to the dentist for every time, because as you know, just go to dentist is more cost more expensive and more time to pay time to go to dentist. So if you can check the cleaning every day in home, so and they are not easily to get the kind of oral disease.
How long does it take for one scan, like a complete scan on one person, and how often do you recommend them to do this?
Takes every time after you clean your teeth. After you brush your teeth, you take this to check. And the scan time is about 1 or 2 seconds, just every piece of teeth to check, to take the photos and to light up at it. Yes.
Thank you.